healthy self. And I am here today with Ken Baird. He's a physician assistant, phenomenal medical provider of regenerative medicine services, functional medicine. It's just been incredible, integral part of the St. George, Utah clinic down there, East West Anodyne. And so Ken, welcome to the show.
Good to be here.
It's really good to have you here. And I just before we jump in, I want to thank everybody for being on the show last night on our training, our health accelerator courses, our hacks. Last night we talked about thyroid health, and we had over 70 people on it. Ken, you missed out. It was a phenomenal event. Really fun to see everybody. So for those of you who were on it last night, how did you like it? I thought it was pretty darn good. And what were your thoughts on last night in our health accelerator course?
That was awesome. So having it as a meeting where everyone was bringing up their video, we had like 70 people. It was awesome energy from everyone. Yeah, I loved it.
And so our next challenge is this week's challenge is some yoga poses that we did for the neck. So hopefully you guys have already done that today. This morning I was doing mine after I did a little Peloton workout and some stretching, got my neck going. So hopefully you guys are doing that to get your thyroids healthy. We talked about foods to eat, foods to avoid. And next week, we've got another really interesting challenge that I'll be bringing to the table for all of you who are looking to move your health to the next level. So today we've got some great things we're going to be discussing. We may have Dr. Paula Marchionda joining us a little later too. I know she's en route to Here to Go Wellness. We've got a big event this weekend. But what we're going to be talking about is just a little experience transformer of, before COVID and after COVID. And I'd love to get insights on it. And I want to have this be kind of a free thinking opportunity where you guys can ask questions, because Ken, I know you and I are getting asked every day, like, should I get the vaccine? Should I not? What do you think of masks? And what do you, and it's just like, let's let everyone think freely here and have just some dialogue on it, dialogue around the testing, the PCR test. We're not going to draw any conclusions today, just so you guys know, this is an opinion-based conversation that we're having. Holy smokes, and there's Dr. Marchionda. Hello, Paula.
Hey, good morning. Sorry I'm late.
It's all good. I was born late, so this is perfect. I love it. Thanks so much for joining us. And I was just letting people know that what we talk about, we are not the CDC, we're not the local health department. So what we talk about today on COVID is simply us having an exploration of thought. There's we'll share some science and some facts, but we'd love to get your insights on things too, because I think now more than ever, we need some dialogue, and it actually really helps to look back and reflect on how things have come about. So does that sound like a interesting topic for you, Paula? Do the rules of the game sound okay? No one's right, no one's wrong. Let's just let's have some open dialogue and see if we can't further our understanding of humanity with this discussion today. Fair enough?
Sounds fun.
Okay, so let's go back. Let's everyone go back to before COVID. So if we go back a year ago, things were scary, right? We're seeing all these, like, we're the media is trying to say, like, how do we respond to this? We're now getting the first cases in the United States, and we'd shut down travel. No one from China can come into the United States, and now we're like, okay, well, where do we go from here? And what's really happening? And so that's where we were a year ago. And then it was March 15th, everything shut down. And so Ruth put BC, before COVID. Yeah, that's right. So we'll go BC and then AC. So BC, AC, it's almost like AC/DC, but not quite. A great band. AC is after COVID. Yeah, AC/BC. Yeah, so we're in the AC era. But you know, Dr. Paula, if we put you in charge of the entire response and you had a crystal ball a year ago, what would you have done the same that happened already, and what would you do differently?
Wow. So
Just
I'm
answer
not
it really
sure
that quick. Yeah.
the same. I'm not sure there's anything I probably would have done exactly the same, right?
Okay. So there's
But and this is a completely different philosophy than standard Western medicine, how I was trained. But I would have, if we could have, it would have been nice to improve the immune health of the entire planet, right?
cool.
But definitely our own communities and our country. And that's like a much longer discussion. But instead of finding random drugs to use, which we now have research that says the ones that we're even still using really aren't the most effective. And there's one or two others that have some more efficacy actually against COVID, even though they've been approved for something completely different. It just seems like we're not paying attention to the research. So I guess what I would say is I would have loved to have seen a public health component about improving and bolstering our own immune systems. And then secondly, really looking through other research outside of what we normally look at to see what works.
Got it.
I
Okay.
don't know if that's a good enough answer.
Like I said, there's no right or wrong answer in this format. So the good news is everyone can speak freely. And Diane asked, you know, I heard there is over a 96% chance of surviving the virus. So my thoughts are, why would I take an experimental drug? I'd rather take my chances. And that's a great opinion. That's a really valid argument. I can't argue with that. And we'll get into the vaccine, or if you can actually classify it as a vaccine. I guess we'll call it gene therapy. Seems more more accurate. But we'll get into that in a minute, Diane. And so you'll maybe you'll learn a little bit. Maybe you'll decide, yes, it's something I need to do, or maybe you'll say, no, I'm not taking the risk. But so yeah, so I think that's a really good thing. So just to summarize, Dr. Paula, there's the one thing you would have done different is educate people on immunity, and you've been doing that your whole career. I mean, you come to Go Wellness and just knock
I'm
us
board
out.
certified in preventive medicine, so I like to prevent things from happening. So I would have really taken that angle on prevention, because as I think we all know, Western medicine waits till you have a problem and then tries to deal with it. It's too late.
Too late, yeah. Well, and especially when, you know, we've got infectious disease doctors coming up, they're drooling because it's like, this is the moment we've all been waiting for to treat the infectious disease, right? I mean, it's no different than the surgeon who sees a knee that's bone on bone and he's like, oh yeah, I get to do my craft. This is great. So as a preventative medicine doctor, realize that Paula's got her own bias. And as an acupuncturist, I've got mine too. And I would say the same. I'd say, well, let's harness the chi of the body. Let's get the body's innate and adaptive immune response as primed as we possibly can. And so I couldn't agree more with getting the education. So let's, Ken.
Quick question, Paula.
Yeah.
Are there some general areas that you would have liked to have seen enhanced or more information given to people about, as far as just the preventative side?
Yeah, so I mean, I think, so I also have a master's in public health. You get that as part of a preventive medicine residency. And so we study epidemiology and how kind of things progress. And what I've seen with this pandemic is nothing I didn't expect to happen, especially with how the response took place. So we tend to not educate people in this country. We tend to be very fear-based, and it would have been nice if there was somebody who could have explained a big picture that people would have taken in on kind of like how a virus behaves, what the epidemiology, like the epi curve we call it, how that really looks. Because to me, everything that's happened is congruent with what I know about pandemics and viruses and how they respond and things like that. It's nothing new. And I'm not saying I'm Nostradamus, and I could, you know, some people might be too young to know who that was. But, you know, I don't have a crystal ball that can tell you, oh, this is how it's going to act. But it followed a pretty general curve of things. Although I think more rapidly, because if you compare this to the 1918 flu, I mean, we are a much more mobile society. So I think it was ramped up faster.
Sure.
But maybe instead of this whole fear-based education, executive order making, if it was based more on, hey, this is likely what's going to happen. But we also had no clear person giving that information to people.
Sure.
So it was very confusing, which also ratchets up fear and anxiety.
Right.
And I think we could have allayed a lot of that.
Yeah. Great. Okay, Ken, I want to hear your insights. If you could go back, you know, a year ago, and you could do things different, or you could do things, what would you do the same, first of all? And what would you do differently? And this can be global, this can be our reaction to it. So Paul, I love what you said about the fear. You know, maybe we could have clear communication instead of having a communications like a ping pong ball. And I think that's what the media loves, because we're all stuck to the TV. Like, well, how serious is this thing, and how big of a threat is it? And are my kids going to be going to school tomorrow? Are they not? And are we doing the right thing? And then you see all these people fighting against each other, and the media is just drooling, because just like the surgeon who sees the bone on bone, the media is like, I got a captive audience. I got everyone's attention. So yeah, thanks for sharing those things, Paula. Ken, I'll let you talk now. Sorry for my tangent.
Sure. As I look back, it seems like one of the difficult things has been realizing that while we had feelings for while we had an idea of how a virus was going to progress across the country and world, this is an initial experiment for us, as far as, hey, here's something that our immune systems are not primed to experience, or that we're not aware of, we're not immune aware of. And so at the start, if you think back, you could look every single day and you'd get one projection saying, hey, by March, we're going to have 10,000 people sick. No, by March, we're going to have 100,000 people sick. No, by March, we're going to have 1 million people sick. And so we had numbers flying all over the place, which each, as best I can tell, each person would come up with their theory on how this was going to progress. And if you just switch one variable by a point or 2 points, all of a sudden your end results are way different. And to be sitting there, I don't think people understood that let's use the word scientists, are making their best guess, but it's a guess. And so there was sort of this expectation, all right, medicine knows everything, medicine has the answers, medicine's got it all figured out. And suddenly, for the first time, we had a situation where medicine didn't have it all figured out. And we were sort of muddling along like everybody else, trying to say, what's the best way to approach this, and how do we take care of this? We see that if we look back at the early treatments on, if you got hospitalized and put on a ventilator in the early days of having COVID, your chance of dying was extremely high. Yeah. And over the last year, as we've emerging room physicians and as doctors have learned how to handle it better, we've been able to bring a lot of that down so that the death rate's not near what it was in those early days. But I think whether it's just a societal expectation that, hey, medicine has it all figured out and let's just go, or just the way it was delivered by the media, we confused a lot of people who then had no idea what it was they were trying to know, what they should take out of this. And in confusion, people will seek an answer and come up with one that makes sense to them, whether it makes sense to others or not.
So yeah, and I when you talked about the numbers, you know, remember Flatten the Curve? That was the whole, like, hey, we just got to close things down a couple weeks to flatten the curve. Mm-hmm. And so would you even have brought up the term flatten the curve? Do you think that was meaningful and helpful? I mean, I don't hear it anymore, but.
I think I know what the goal was, which was looking at hospitals and saying, if these sick patients continue to come to the hospital. If they're staying twice or 3 times as long in the ICU as a regular pneumonia patient, if they're dying at a much higher rate, do we overwhelm the hospitals? Do we overwhelm providers? Can the system keep up? And so my guess is that someone said, hey, if we can at least slow that progression down, then we have a better chance of not overwhelming the system. However, flatten the curve could never be a total outcome, because if we look at it and say, until we have some amount of immunity, and herd immunity, whether that's through people getting sick or through vaccination, it's still gonna run through the society. And so I remember having a conversation with a friend who's like, Ken, what happens when we reopen everything and everybody gets sick? And like, Joe, that's a very likely possibility, which, as we saw, come June, it did. And so I don't know that flatten the curve helped anything. I don't think it hurt anything, but I think it may have pulled our focus off of trying to do things, as Dr. Paula said, to be healthy in ourselves, to strengthen our immune systems, so that if we got it, we would have a better chance of getting through it unscathed.
Yeah, I think that's brilliant. Paula, it looks like you have a comment.
Yeah. I mean, the whole flatten the curve thing was, not to overwhelm our hospitals, because a new virus, they didn't know what to do. They used, methods that they would use with other respiratory illnesses, and when we found out, yes, it affects the respiratory system, but it's not really a respiratory illness.
Yeah.
So we didn't know that in the beginning. Frontline workers, somebody having trouble breathing, we intubate you. You kind of follow standard protocol. Standard protocol did not work for this virus. So the whole flatten the curve thing was trying to not overwhelm our hospitals. And the economic impact of closing things down kind of threw another wrench into the whole system.
Yeah, I just read a statistic, United States is down about $16 trillion in our economic, our GDP. Like we're just, it really hit us, it hit us hard. And that's like real lives on the line. More kids are going hungry, more people unemployed. I mean, I've seen the homeless population almost triple here in Salt Lake. So yeah, I think there's some unintended consequences that happen when we do flatten the curve. Yes, we're trying to be supportive. And the beautiful thing I learned about this, and a piece of appreciation, is how much humans really care about life. Because we're willing to put our whole life on the line and just say, hey, we're going to pause everything. We're not going to go out. We're not going to have family functions. We're going to stay, quarantined as much as we can. We're going to wear these uncomfortable masks. And so I really love the compassion and humanity that it brought out in so many people. And so for those of you who, do honor life like we do here, I just want to thank you for the sacrifice. And so we're having this conversation. So we say, okay, now that we understand that, yeah, we've done some great things, but, are we heading in the right direction? And so if we look at, and I appreciate Ken and Paula, thank you so much for your insights on that. I think it's really intriguing just to look back and be like, holy smokes. Yeah, there's all these graphs and these numbers. And like Ken said, the next day, some other statistician would get in there and all of a sudden we'd see the numbers like explode. And it's like, oh, everyone's going to die. And then when you saw New York, it was just heart-wrenching. I mean, the amount of deaths and some of the predictions are, we probably lost about 35,000 more lives than were necessary because of the treatment, because we didn't know. And there's no one, once again, this is not a blame game here. We're just trying to learn from our experience. And my heart goes out to all the physicians who were there. A lot of them I do know, and they went through an enormous death toll there it was scary for all of us. And so if we go back and we say, okay, well, now we're a year later, and now we're still pretty much, there's some areas that are still shut down. My kids' school, one of my kids goes to my kids in Park City. Their schools have been open. They're now getting tested every 2 weeks. They've got to get tested with this PCR test. I have another son of mine who's at West High in Salt Lake City School District. Got sued actually, where they had to, basically they're reopening for 2 days out of the week now, which is great because well, you guys know Dominic. He's just he wants to interact with kids. So, my wife is sure patience has run out, and she's like, get him back in school. And so now we're at this stage where we're slowly reopening. But what are some things that you think would be really helpful for people as we kind of integrate back into society? And maybe we could start with you, Dr. Paula, and then we'll move on to you, Ken.
Well, I mean, you hear me harp on this all the time. I still think strengthening your immune system. I mean, if maybe this could be politically incorrect. I know you're not used to hearing things like that from me, but maybe instead of a $600 check, we should have gotten a year's supply of vitamin D.
Hold on, wait, whoa. That's edgy.
That would have been way cheaper.
Yeah.
And it would be a lot
and more effective.
Yeah, because if you're working, I mean, now we have someone who has the sniffle in the office and they're home for 2 weeks. I think I may have COVID and I better get tested 5 times before I,
And one thing, so this doesn't answer your question at all, but one thing I've noticed is happening is, I have a headache. I have sinus congestion. I have a sore throat. I just feel tired today. Oh, well, you better go get your COVID test. There are still other ailments out there, like the regular flu, like strep throat, like a common cold. Yeah. Just because your COVID test is negative doesn't mean you still go to work when you're sick.
Man, I had a 13-year-old patient yesterday who's had like 4 viral infections. And every time he goes to his pediatrician, the pediatrician's just like, it's got to be COVID. And he said, they tested me like 12 times and it's always negative. He's like, do they not know there's other diseases? And then I got a 13-year-old telling me, well, Regan, do you know, like, what happened to influenza this year? And I'm like, oh, yeah.
There is some very interesting data. I mean, a friend of mine is a physician out on the Hopi Reservation. And they, by this time in the season, they usually have deaths from RSV and severe flu cases. They have had absolutely none this year. And I don't think that's because RSV or flu have gone away. That is not what I'm saying. I mean, the reservation, the Hopi Reservation is within the Navajo Reservation. And I think we all heard the news about Navajo Res. And their rate of COVID in Hopi is 3.5 times greater than if you're not in Hopi.
Right.
And they have been trying very hard. And they've also, this is also very interesting to me, they have been getting a lot of good support. Whether or not you agree with remdesivir as a treatment, they have enough to treat the entire Hopi nation.
Is that right?
Yeah.
Oh, that's phenomenal.
They have gloves, masks, full gowns, hood, they have it all.
Let's get it deployed. That seems like the most,
I mean, they're using a lot of it.
Yeah.
So I don't think it's a stockpile or anything. They are using what they have, but they have it.
Yeah.
And I think part of that is because they're part of IHS, Indian Health Service, which is part of the federal government. And some of that was preserved. And even our director of the VA was making sure that our neighboring nations like the Ute and Ouray and Uinta and Ute, Mountain Ute, Southern Ute, I know I'm leaving ones out, but that all of them had adequate supplies too. He did that, and he said that in a press conference around here. So that didn't really answer your question at all. I just went off on a tangent. Sorry, Regan.
No,
It never happens.
Yeah, I've never done that in my entire life. So you're forgiven this once, but if it happens again, we're going to have to put you on mute and I'm going to have to censor you.
But again, I think our immune system, we can never have a too healthy immune system, right?
Right. And Diane, so Diane was wondering, she has 2 comments. Number one, what exactly is herd immunity? And we'll talk about that in a second.
Oh, yeah.
And then she also said a couple of weeks ago on montana.gov website, there have been 0 confirmed cases of the flu. So where are those statistics going? They're probably calling them COVID. It's kind of the assumption. So,
Well, or they're not testing. Because if they don't do the tests, they don't have the stat. They're only testing COVID.
right. Yeah.
And I mean, we are washing our hands more, wearing masks more, keeping away from people more. So that is going to decrease the transmission of cold, flu, and all the stuff as well.
Yeah, absolutely. Yeah.
Knock on wood. Knock on wood. I would say that I have had much less infection this winter than typical. Sure, am I trying to do things to help my immune system? Absolutely. But I also know that just the fact that taking some of these precautions, as Paula was talking about, has made a direct impact on me personally, as far as my incidence of illness this winter. I'm probably down by 2/3 of what I would normally have by this time in a typical winter time.
Nice.
That's great. And so, Ken, what would be your advice as people are getting back out? And I love that. Thanks, Paula. Get the immune system. And on our immune masterclass, which Paula has courses in there that we created together at the beginning of this, nothing's changed. It's all the same. Vitamin D, zinc, get out in the sun, exercise. It's all there. But anyway, sorry, Ken, go ahead.
That's fine. I would start with just getting out. I know there's a lot of worry and concern about people who have been alone, who've been stuck at home.
Sure.
I have a 25-year-old son who works from home out of his basement, and he's renting a room in a basement. And he says, I just get so tired of sitting in this room. I go to work and I'm in my room, and I get done with work and I'm in my room. And so it was very difficult for him the first months of the, not that he was ever on quarantine, but just back in June and July, that all of a sudden he was supposed to be in his bedroom basically the whole time. There's no place to go. Couldn't go to the, I'm getting all emotional there. Couldn't go to the office because the office was shut down. And so we worked with them saying, all right, what are you going to do to get out of your place, outside, go be, you don't have to be with people initially, but go be outside doing things. And eventually he was able to start to set up activities with a group of friends where they would go to the park and they would socially distance, but they were outside and far enough apart that they could see each other and they could interact. And so I would say that we need to start to work on that. Believe that our immune systems are most likely intact enough that if we're outside around people interacting, but at a reasonable distance, that we're going to be okay and that will do wonders for our mental health and our outlooks going forward.
I love it. Yeah. Yeah, and I've never worked out as much as I have in 2020. I mean, it was twice a day. It was it was awesome. I've never worked so hard either. I mean, it was nonstop because it's like, yeah, when you get used to working in front of a computer that you can carry anywhere, it's kind of dangerous at the same time. So I think those are awesome things. And I'm curious why neither of you mentioned go get vaccinated if you're going out.
That's not like you just didn't open a big, huge trap door in a hole and say, come on, let's wade into the swamp together.
Okay, so I wanted to
we can go there. That's fine.
But it is.
Can we go somewhere else before we go there?
Yes,
though?
and I want to talk about.
It dovetails perfectly with Ken, and he'll love that I'm delaying the other conversation. So we cannot the mental health toll this pandemic has taken, and not just for us as individuals, but really globally. This is, I mean, we haven't lived, I don't think, through something that has impacted almost every individual on the globe as dramatically as this ever in this generation, in the generations that are alive now. Now, there are some people still alive from World War II, maybe Korea. So through war times, potentially, but otherwise, and in my life, I was thinking about this, and nothing has affected me in my place in the world and with other people like this has. And I mean, yeah, I had cancer, but that affected me, not everything around me. This has affected everything. And the isolation and the fear and the anxiety, I've gone through more things I use for anxiety, depression, fear, insomnia than any other year.
Wow.
It pretty much always comes up. And let's face it, Americans underreported their bad sleep in the beginning anyway.
Right.
Now they might be a little more comfortable saying it because there's a reason for it.
Yeah.
But our mental health has suffered exponentially. And I was very pleased when Colorado dedicated specific funding for mental health.
Did they? That's great.
Yeah, our governor did that. It's got to be at least 6 months ago. It was a
Okay.
while ago he did that, and there was a consortium they formed, and they really got more services out there, and it was great, like telephone servicing, Zoom service. Oh, they did a lot. I was very impressed with that. But if you take this adult down through child, the mental health effect on children who couldn't be with their social groups at school, how it affected their learning, group learning versus individual learning versus online learning. It's a
Right.
very different animal.
So different.
Sure, it'll prepare them for online college because that seems like what most of them are doing anyway. But that socialization, that, let's face it, we're not good communicators anyway. So you put this on us where we aren't interacting with people, where we're not getting the physical touch. And, I don't go to that other place. I just mean like a hug or a handshake. But
Sure.
a hug and a handshake also produce oxytocin, and we have not had that.
Yeah.
We haven't had those interactions, and we suffer mentally from that. We are a gregarious social animal.
Yeah.
So being isolated, and I think, my scientist hat goes, oh, this is a very interesting sociology experiment. My sort of health provider or healthcare advocate, whatever you want to call me, my doctor that cares hat is like, okay, what are the ramifications of that? And how do we try and mitigate it? How do we support people without being like claustrophobic to them, suffocating them? It's like we did a Facebook Live last week on toxic positivity, and it was like one of our best received Facebook Lives.
Yeah.
Because it's great to be positive, but there's toxic ways of being positive that aren't helpful to anyone. But this whole mental health component, and we're in a very interesting place in our nation, and I assume other countries are too, because of all the stuff that has gone on. And it'll be interesting how we pull ourselves out of it and find a way to rebuild our country, because that's what we have to do.
Yeah. Yeah. Well, and the world. I mean, if you think about it, Paula, like you mentioned World War II, like we've never gone through something as a cumulative whole since some of the world wars, but even World War II, like there wasn't a whole lot of Africa or South America really impacted by it. But now we got like all the continents, everyone.
And our geographic country was mostly unscathed during World War II.
Yeah, Hawaii got hit, and then we said, "That's it. You're not."
But not like the devastation in Europe and England.
Oh, no, and so now we've got it worldwide, and we have this, these psychological hits. I remember driving on the freeway in Utah, and I saw a sign that says deaths from overdoses and drug abuse and alcohol, and it was like 850. And then I told my kids, I'm like, you know how many deaths there are from COVID in our state? 600 at the time. It was a few months ago. And I was like, man, I wonder, and then you look at the amount of benzodiazepine prescriptions, they went up 38% last time I saw. You look at the alcohol consumption. I saw in one state where it was up almost 50%. Like, that's scary.
My patients who own liquor stores, they're doing fabulous.
They're going gangbusters. Yeah, gangbusters. And, I see the Dragonfly Wellness, the medical marijuana place. I mean, there's lines out the door every morning. I'm like, this is ridiculous. Like there is a psychological toll that we have to confront. And Ken, I appreciate what you said about your son as a 25-year-old. You know how uncertain life is at the age of 25. Like, you really don't know your head from your feet still at 25, and you're just trying to be an adult. And I can't imagine the uncertainty. You throw one more level of uncertainty on, and that's where, must have been crippling.
It was difficult for him. I want to focus on one thing in the comments from Ruth Feldman. She was talking about the fact that the mental health impact that her bout of COVID had on her, and the fact that after she had COVID, she became depressed. And that's something I found interesting because I first saw it in my youngest son, who had what we think was COVID this past fall. He tested negative. They told him he had strep throat, but he had all the typical symptoms. And so we thought, okay, maybe it's just a false negative. And then he developed the worst depression he's ever had in his life, to where we weren't sure we were going to be able to get from Utah to Colorado in time to have him be there when we got there, because he was suicidal. And he has fought that for the last couple of months. And so as I saw that, I just thought, I wonder if it's something to do with him likely having COVID. And so in looking at the data, it looks, commonly up to 25 to 40% of patients who've been diagnosed with COVID have depressive or psychological types of issues where they struggle emotionally with, as a side effect, as an outcome of having had the COVID. And it's been interesting to see that and to watch people struggle with that unknown or unseen part of the disease, because it's not easy to say, oh yeah, I'm depressed today, and that's just because I got sick. People are like, well, that doesn't make any sense. And yet, just having watched it in our lives, where it took him 2 or 3 months to come out of the depression he got from being ill.
Yeah, wow. And the neural inflammation, I mean, I think it's massive. And that's, one of the things that we can talk about when we do dare to talk about the vaccine is what the patients who do have neural inflammation, neurodegenerative conditions, is that more risky? Is it less risky? But yeah, is your son doing better now, Ken?
He's stabilized and is improving, and so he's learning a new way of looking at life.
It's great. Yeah, it is an interesting way of looking at life. I look at my kids. My kids are all teenagers, and I'm like, I don't apologize to them. I say, this is a great opportunity. I try to, like, look, we get to be together more. You guys you have quite a bit more freedom and flexibility. But man, it's something I never imagined. I couldn't have predicted this. And I don't know how I would have done as a teenager or in my 20s. I mean, in my 40s, I'm struggling. I mean, every day is like, I've got to do my mindset morning and just get that out of my system. Like, it's okay. It's okay. We're going to get through this. And even when I completely disagree with some of the practices that we put in place, it's like, it's okay. I can accept it for what it is. And it's hard. I don't accept it every day, as you guys obviously have heard, but I try to accept it most days. At least,
well, what's another thing that, like, I've felt lately is, I mean, this is going on a long time.
The
And
curve.
and I didn't think it was going to be,
yeah.
I didn't think it was going to be a short-lived thing.
Yeah.
I believe it's with us for the rest. It's along with, it's
viruses don't
with us
go
for
away.
the journey.
Yeah.
It's not going to go away.
Yep.
But what we've been doing to try and control and mitigate it from, I guess, a governmental and whatever state-run programs and things, it's just getting exhausting.
Yeah.
And like, I think I've survived the pandemic thus far quite well, but it can still get just exhausting.
Yeah.
You know what I mean? Just that constant level of stress.
And the thing about it too is that level of stress, it's blown up where now, as Ruth mentioned earlier, and a couple of you, maybe it was Diane, but we now it looks like it's almost political. Do you wear a mask all the time? Do you not wear a mask? Do you get vaccinated? Do you not get a vaccine? And I think one of my big concerns, and maybe we can touch on it a little bit, is the amount of censorship that's going on and the lack of debate that's out there. It's like, well, just to bring it back full circle, we talked about, Paula's, she's a preventative medicine doctor. I mean, she's board certified, and I'm an acupuncturist and a functional medicine practitioner. So I look at prevention as like the key in keeping your chi vital. So we get that we all have biases. Ken's also looks at the body from a completely holistic perspective. So, but now you've got people who are running it who are, you know, infectious disease, and these people, they're looking at things through their one channel, one pathway. And so is it the censorship, is it helpful? I mean, do you guys know what's happened to people who talk about, you know, if you're an anti-vaxxer, then that's like a big thing. I was, you know, I saw on Twitter the other day where a person said, oh, my uncle got the vaccine and he died a week later, and I don't know what to say. And then all the comments were like, sorry about your uncle, but I hope you're not saying that you're trying to dissuade people not to get the vaccine. Like, sorry about your uncle, but hey, this is not a moment for you to start being anti-vax. And so I think that there's a discord going on. I think we've got some challenges in just having the freedom to speak openly about the disease. Is the disease worse than the treatment? And is this treatment, is it vetted out? Is as safe as people want it to be? When there's cars piled up in Denver, I don't know if you saw that over the weekend, Paula, 10,000 people are vaccinated. There's cars just miles long of cars. I mean, that's some great marketing for a treatment.
So I just jumped in. You didn't even ask me to. So as a preventative public health trained physician, every time I retake my boards, which luckily is only once every 10 years, there's, I don't know how many questions on vaccines, right? So in public health, historically, vaccines have really cut down a lot of disease, mortality, and morbidity. Like the one we love to talk about is polio, right?
Yeah. Oh,
Polio is virtually eradicated in the entire world, except for Pakistan and Afghanistan. And there's reasons for that. They're under a lot of, well, let's just call it pressure right now. Their healthcare system is suffering due to what's going on in their countries, and it's harder to get things out. Polio almost made a bigger comeback. And polio is a devastating disease that has long-term effects, assuming you survive it.
right.
But we are so far removed from a lot of the childhood illnesses that we vaccine for. We are so far removed from the mortality and morbidity of those that it's easy to say, oh, it's not a big deal.
Yeah.
But diphtheria, mumps, rubella, measles, mumps, rubella is like all in a combination. I mean, tetanus, most people have never seen anyone with tetanus. It is
Right.
not a pretty sight.
Oh.
It is horrible.
Have you seen somebody? I've just seen pictures where they're all.
When I worked on the reservation, I did.
Oh.
And when I worked at UNM in the Level 1 Trauma Center for pretty much all of New Mexico, Northern Mexico, Southern Colorado, Eastern Arizona, and Western, what is that, Texas?
Yes.
We got everything from the reservations and everywhere. And like, we saw the first cases of hantavirus and things like that. So great learning experience. That was a frightening time, but we haven't been exposed to, and I've done some medical missions in other countries, and you see things you don't see here. So I want to say that in some ways, vaccines have helped us live a healthier life. Now, I want to say vaccines generally take years to develop, sometimes decades. Research done quickly can be fraught with problems and things we don't know. We don't even completely understand after you've had COVID, how long does that immunity last? Last I heard, we had data that supported it lasted for at least 6 months. It might be a little longer now because there's been a longer time period for us to study it.
Yep.
But this is all new with this virus, and rushing something like a vaccine I can't even speak. I have a lot of caution.
Sure.
Everyone getting the vaccine is basically part of a phase 3 trial. This is not an approved vaccine. This is an emergency use authorized vaccine, gene therapy, whatever you want to call it. The Pfizer and Moderna are a different kind of vaccine than has ever made it to market. So there's a lot of things that give me pause personally. I have plenty of colleagues, friends that have gotten either one or both of their vaccines, and that's fine. I think it's a very individual decision depending on what's going on with you. I have at my disposal, because of my clinic, like you guys, like you, Ken and Regan do, I have tools that will help me if I get sick. So
that's a real gift.
I have other treatments available to me because it's my clinic. It's easy for me to get them. So I myself am not getting the first wave of vaccine. I take a lot of other precautions and boost my immune system. One of my employees has a different, character to her health. She already got her first vaccine. I think she gets her second in a week or two.
And just I mean, wouldn't you think if somebody had more of a compromised situation in their health, we would want them to get it last, and we'd want to try it on the healthy people first?
So that's a really hard question, because if you are already compromised and you get COVID, quote, naturally, you are at a lot higher risk to have more severe complications.
If you get anything, COVID, or if you get the flu.
Right, anything. But since we're talking about COVID, with COVID, and we now know some of the things it does, you're at a much higher risk of some, morbidities that could follow you for a while. Some, not side effects, but ramifications of having the actual virus.
Sure.
So the question is, and I don't think we have this answered, is if you get the vaccine, how are you going to tolerate it? Yep. Is your immune system healthy enough to build antibodies? And 3, is that a more controlled, safer way for you to get your first exposure? And is it better for you?
Right.
And we don't know. And we're hoping and praying that the right decisions are being made. And I think it comes down to an individual decision and what kind of risk-benefit ratio you're comfortable with.
Yeah, and I guess it goes back to the censorship. Some of the reports that I'm seeing is showing that the vaccine might be more dangerous than the virus itself as far as side effects and complications and deaths. And so it's like William Osler, he's the Yale medicine director. He founded it, but he says, in Western medicine, there's always 2 cures that have to happen, one from the disease and then one from the treatment of the disease. And so I'm like, are we creating this? And then Diane asked, let's just get clear, like a vaccine. Let me just state what the dictionary says on what a vaccine is, because there's a lot of biologists and people who are far smarter than me who are saying, I think this is gene therapy. It doesn't really classify as a vaccine, but yet we're calling it a vaccine. So a vaccine is a substance used to stimulate the production of antibodies and provide immunity against one or several diseases, prepared from the causative agent of a disease, its products, or a synthetic substitute to act as an antigen without inducing the disease. And so this is, I looked at the ingredients, because I've had so many of my patients say, should I get the vaccine? Should I not? What do you think of the ingredients? I pull up the ingredients, and it's like, oh, there's a lot worse things in some of the other vaccines that are out there. But this one, there's that one kind of scary thing, which is the CRISPR technology in the mRNA. And so CRISPR technology is where you go in and you start, you put different messengers, you splice some DNA, and you can create a perfect baby, right? And so but they are using some of that same technology to induce these spike protein activations on the surface sites of our cells. And is it actually a vaccine? I mean, or should we be calling this gene therapy?
It seems to me, Reagan, that my understanding of the vaccine and the mRNA component of it, if we go for a 90,000 foot concept idea here, we can say that DNA makes RNA and RNA then leaves the nucleus and goes out and makes proteins.
Yep.
And so if we stay at that 90,000 foot level and we say, all right, someone's going to use mRNA, what are they going to use the mRNA for? And in this case, the question is that mRNA going to somehow be able to go back in and overwrite my DNA and put new genes into my own genome? I don't see any evidence of that happening. If the mRNA is going to go out into my body and say, hey, make bits and chunks of substance that looks just like the bits and pieces of the COVID vaccine, or excuse me, the COVID virus, then if I think about vaccines are, I may take an actual virus, make it weaker, and then give it to you and say, all right, I'm going to make you just a little bit sick, but that way you won't get really sick. Or I may take the virus, break it up into little pieces and give you a bunch of pieces of the virus and say, all right, you're going to have a reaction to these pieces of the virus, but they can't, because they're not an intact virus, they can't make you ill. And so I can look at this from a technological point of view and say, if I'm telling the body to make bits and pieces of things that look just like the virus to trigger an immune response, we're still going to see an immune response.
Sure.
And so if the concept is for a vaccine that I'm going to create some sort of an immune response, then it would be behaving as a vaccine. If you use the term gene editing, the implication is that somehow if I gave Regan the vaccine, it was going to go in and change your genes permanently. That's a scary thought. It's very worrisome. I don't know that there's any evidence that occurs. My understanding is there isn't. Any thoughts on that, Paula?
So the Pfizer and the Moderna are mRNA vaccines. The AstraZeneca and the Johnson and Johnson, and if you guys know more, correct me, I thought those were DNA vaccines. So those would enter the nucleus.
Yep.
mRNA vaccines are new. They are, and I agree with you, Ken, that they should not enter the nucleus. Because mRNA is exported to the cytoplasm to make whatever it's supposed to make, and in this case, that's a spike protein. So I agree with you on that, but supposedly the Johnson and Johnson vaccine is very close to being EUA'd. Frankly, I haven't looked in a couple of days, so I could be out of date. And AstraZeneca, I just read something on that, but how they initially developed it gave me pause. But it was supposed to be altered before it gets to EUA, so I'd have to look at that. But the vaccines are different, and the ingredients in the vaccine are different, obviously, because different companies make them. Moderna's ingredients, when I briefly looked at them, looked a little cleaner than Pfizer's.
Yep.
But they all have propylene glycol in them, which,
Yep.
what is that?
Just a little gasoline in your
That's
system.
antifreeze.
Oh,
Yeah,
is that what?
antifreeze.
That's antifreeze?
That's antifreeze. So, although I didn't see mercury, didn't see any thimerosal, so we're
I
good.
didn't see any of that either. No heavy metals really, but
No heavy
yeah,
metal.
flame retardant. So,
But it's really interesting, and the reason they want the vaccine out there so fast is to generate herd immunity.
Which goes back to Diane's question.
Which
goes
is,
back
yeah,
to
it
Diane's
goes right into
question, which
Diane's
goes back
question.
to, we are running out of time, and which means we have to have session B, because I think everyone really enjoyed this, and I know there's a lot of thoughts that you both have, and so we are, let's just kind of summarize real quick here. So herd immunity, can you do it in 1 or 2 sentences, Paula?
So you need a certain percentage of the population having been exposed and have antibodies, and theoretically that protects the rest of a community.
70 to 80% is what most numbers people
What
throw,
most,
but we
yeah.
don't know exactly. Yeah, so that's what it is, Diane, and it's still kind of a nebulous concept. I'm skeptical that it is even meaningful. So, but okay, so we're gonna have this again. We'll invite you guys back on. Paula, Ken, I love you guys. I love working with you guys, and they're great partners in the clinics. And for those of you who have been their patients, just we have the best of the best. So thank you for having an open dialogue, for the respect, and thank each one of you for your questions. We're going to come back with a part B as soon as we possibly can get it organized. So thanks everybody, and you guys, if you're not on our healthy accelerator courses, get on there, and we'll post a link. Purchase our golden ticket and get on there. And I will see you guys Wednesday at 4:30, and then we'll see you next week here on Your Healthy Self. So thank you so much.
Thanks, Regan.
See y'all.
Bye. See you soon.